This week, we learned that Jacksonville City Councilman Terence Freeman is battling prostate cancer, and he is scheduled to begin treatment sometime next week. Now, he posted the news on social media on Thursday saying, "It is important to me to be transparent about where I am with this diagnosis and acknowledge that I will miss council meetings in the months ahead. This is the same insidious disease that affected the quality of life for my dad, but early detection is key to saving lives." Councilman Freeman went on to encourage men to schedule a prostate exam, and he wrote, "Prostate cancer is 100% treatable when caught early enough, but many men do not get screened." He went on to say, "This is especially important for Black men who are 2.5 times more likely to die from prostate cancer than white men." He also thanked his family and medical team, saying, "We are going to fight with every ounce of energy we have, and we will win." So joining me this morning is Dr. Balaji with UF Health. We appreciate you being here to talk about this, doctor. Thank you.
Hey, good morning. Thank you for having me here this morning.
Thank you. Well, first, Councilman Freeman shared his diagnosis and encouraged all men to schedule an exam. Can you explain really just how important that early detection is? Can you elaborate?
Yes. So, prostate cancer is very, very treatable if it's diagnosed early. And it makes a big difference at what stage prostate cancer is diagnosed. The risk varies from person to person. It's based on race, lifestyle, dietary habits, and variety of other factors, including genetics. So it's important for every man, over 40 years of age in general, to have a conversation with their doctors, their primary care physicians, to see whether they should be screened for prostate cancer and really understand the risk and benefits of screening and make a decision that they feel most comfortable with.
And as Councilman Freeman said, Black men are at a much higher risk. Can you shed some more light on why that is?
Yeah, so we have done quite a bit of research in this field, and we think there are multiple factors. There may be genetics at play. There are also certain biological factors that may underlie why Black men are not only diagnosed with prostate cancer more often, but when they are diagnosed at a more advanced stage than men of European ancestry. The other reasons could also be other socioeconomic factors, and it may be access to healthcare, health beliefs, and dietary habits. So and exercise. So there may be a lot of other factors that could also be contributing to both the increased incidence as well as when they're present at a more advanced stage in prostate cancer.
Doctor, we have about a minute left. Can you shed some light on what symptoms should patients be aware of, and what are their options for treatment?
Yes, so most men may not really have symptoms, and they may be fine and healthy. That's why there are tests now available that they can have done to see whether there is a possibility of prostate cancer. And then there are additional imaging studies. Not everybody who has an abnormal test needs to have a biopsy. And once it's diagnosed in early stages, there are a variety of treatments. There are robotic surgery now available that really reduces the complications from this procedure. There are other treatments such as radiation, or there are also treatments called focal therapy where they can identify and spot and treat it. Some of the major advances in the field have also been in men who are presenting with advanced prostate cancer, have progressed while on treatment. And in the last 20 years, we have so many treatments now approved by the FDA for this man, and we are prolonging survival. But all this is predicated on timely diagnosis and treatment at centers which do this often and get the evidence-based state-of-the-art treatment.
And it goes to show you that early detection truly is key. Thank you so much, doctor. We appreciate your time to talk about this important issue.
You're welcome, and I thank you for the opportunity. I appreciate it.